Hi, I'm Dr. Eli Whitney, a cardiologist at the Heart and Vascular Institute of Texas. I'm here to talk about a medicine called colchicine. It's an old medicine that has been used for years and has recently been shown to reduce the risk of heart attack, stroke, and death. The medicine was actually used by the Greeks in high doses as a laxative more than 2,000 years ago. By the late 1800s, French physicians better purified the medicine and were using it to treat acute gout, which is a very painful arthritis inflammation, usually in the joint of the big toe, but can occur in any joint in the body, with symptoms that can come and go. Colchicine works by reducing inflammation. Let me quickly explain how inflammation occurs and how we detect it. You've heard me say 90% of all heart attacks and strokes are caused by the sudden formation of a blood clot at the site of the cholesterol buildup. Atherosclerosis is the gradual buildup of plaque in the walls of the arteries that feed the various organs of the body, especially the brain and heart. When the plaques become large enough, they can decrease the amount of blood flow to the body. The first step in plaque formation is when cholesterol is added to the walls of the arteries just beneath the inner skin of the artery. When enough cholesterol is added, then smooth muscle cells, along with white blood cells, the same cells that fight off infection, move into the walls of the arteries and stimulate the formation of fibrous material, which is similar to gristle in a steak. Free cholesterol, the white blood cells and smooth muscle cells inside the artery skin is separated from flowing blood on the other side of the skin by fibrous material. Should a tear develop in the plaque and the flowing blood come into contact with the free cholesterol, a blood clot would immediately develop. Such a blood clot could cause the artery to become completely blocked. Should the blockage be in an artery feeding the heart, the result is a heart attack. Hence, the fibrous material forming in the artery wall is actually protective. When white blood cells in the plaque become overactive, they release chemicals which dissolve the fibrous material that separates the blood from the plaque. This dissolving of the fibrous material makes it easy for the physical motion of blood pressure and blood to break or tear the skin of the artery and allow blood to come into contact with the free cholesterol and cause the formation of a clot. Excess activity of white blood cells is what we call inflammation. CRP is a measure of inflammation. A simple blood test provides a measure of overall inflammation in the body. One of the main ways that the statin medications reduce the risk of stroke and heart attack is by lowering inflammation and CRP. Colchicine has been used for over 50 years to treat pericarditis, a painful inflammation of the covering around the heart. In 2013, a small study called the LOTOCO study took 532 patients who had stable coronary artery disease and randomized them to a placebo or to colchicine 0.5 milligrams per day. In just 2 years, heart attacks, strokes, and sudden cardiac death were reduced threefold. A second small study, also published in 2013, suggested that colchicine reduced recurrent blockages in stents and angioplasty by half. For these reasons, the COLCOT trial was started and published in 2020. In this study, they took several thousand patients who had an angioplasty and stent and split them into two groups. One group received a placebo and the other group received colchicine 0.5 milligrams per day. After an average of just 2 years, strokes were reduced 74%, and hospitalizations for angioplasty and bypass surgery were reduced 50%. It turns out that elevated CRP levels not only predicted greater risk of developing heart attacks and strokes, but decreases in CRP levels carry a substantial reduction in risk of developing heart attacks and strokes. Therefore, the greater the vascular inflammation, the greater the risk of heart attack and stroke. Conversely, when CRP levels fall, there is a greater protection from future heart attacks and strokes. What does this have to do with you? For years, I've been treating people aggressively to prevent heart attacks and stroke. I have really aggressively treated cholesterol, blood pressure, diabetes, weight loss, smoking cessation, exercise, and diet. Yet every year I get 2 or 3 surprises with patients who have tremendous looking numbers but who develop heart attacks or strokes. I am almost certain that these individuals have problems with inflammation in their arteries. The COLCOT trial provides enough proof that therapy with colchicine, 0.5 milligrams per day, can substantially reduce your risk of cardiovascular disease and death. The medication is safe as long as you do not have kidney failure or cirrhosis. Its only side effect, diarrhea, is rare. I hope this video has helped you understand colchicine and how it prevents heart attack and stroke. I'm Dr. Eli Whitney at the Heart and Vascular Institute of Texas.